I'm Amy Wu, and I had psoriasis since I was 7 years old. My mom brought me to the dermatologist, and I first, was diagnosed. My first reaction was like, I didn't know what this was, and I was scared. It first developed like on my scalp right here, and then I went to the doctor.
My name is Ron Prusik. I've been a dermatologist for 20 years. Well, psoriasis is one of those diseases that we diagnose based upon the clinical picture of the patient. So we don't have a good blood test to diagnose psoriasis, and we often have to diagnose it based upon the location of where the red scaly plaques are. So psoriasis tends to appear in certain areas like the scalp, the elbows, the knees, the hands, and the feet. And so based upon the distribution of where the scaly spots are, that helps us in diagnosing psoriasis.
They finally told me it was like psoriasis. They gave me shampoos and like ointments and stuff, but that was it was only contained in this area. And then later on, it started developing in my body, like in high school. And I was, also scared too. I didn't know, what it is. And then it started developing in my back. And then I didn't tell my mom that. And then one day I decided to tell my mom. And then we finally went back to the dermatologist.
Psoriasis presents at different ages. I mean, there's a peak of when it shows up, which is usually the late teens and early 20s. That's the peak of when most people manifest itself. But then there's other people where it shows up at a very young age, and other people where it shows up as an elderly person. It depends upon the genes that they have and what triggers their psoriasis.
Challenges with psoriasis, it interferes with my relationships. I don't know what others think of me, and so it makes us self-conscious. So I actually haven't been in a relationship. I mean, one day, if the right person comes along and accepts me for the way I am, then that would be great.
When I was a resident and we would have patients in the hospital for a week or two, we would do hospital rounds with a dermatologist but also with a psychiatrist. It became very clear to me that this was a disease that was really affecting people's lives from many different aspects, and that's what made me interested in trying to treat these people.
Challenges with using makeup has been a difficulty. I had to use makeup to cover up my psoriasis, which is a big part of my life too. And I have to use the the right kind and the color especially. And normally I have to wash my face, make sure the skin is removed before you put it on, or else it looks like it's so flaky and it's not natural. And that's important, to know if you have psoriasis. Well, difficulties while traveling is I had to, take the injections in like a, lunchbox type bag, and it has to be, refrigerated. Especially if I'm going to Hong Kong, with my family. And I have to keep it in that lunchbox and with the ice packs. And then the flight is so long, so we had to ask the stewardess to give us ice, and then we're not allowed to give it to them to put in their refrigerator because I guess that's like a liability. So we had to keep that all the time with me, like as a carry-on, and that's difficult because we had to keep it cool all the time too. With this injections, you have to bring like a doctor's note when we go through the security, because or else they would, think it's like a, weapon.
As a dermatologist, I do take a different approach based upon how severe the condition is. So for people who have a mild case of psoriasis, we usually treat that with topical therapy. If they have moderate to severe psoriasis, we usually treat that with phototherapy, an eczema laser, or we treat it with systemic medications such as biologics.
I have a plaque psoriasis. I use many things, like I use the cyclosporin, which is like a liquid substance, and then that you take by mouth. And then I use like the UVB light treatment, which I did like in the dermatologist's office, and also I also have a UVB light box here at home. But those lights will help, I guess, slow down the reproduction of the cells.
We have a number of treatments that we can use for people with psoriasis. The topical therapies that we use, such as topical steroids or vitamin D type of creams, are used for people who have mild disease where they don't have that many areas to cover. If people have too many spots all over their body, it's really impractical to start using topical therapies all over their body twice a day. It's just impossible for people to be compliant with that in most cases. So if people have more severe disease, we try phototherapy, where we use predominantly narrowband UVB 2 or 3 times a week. And that seems to work very well for most people who can come to the doctor's office 2 or 3 times a week. Sometimes there's distance issues, or people can't take time off of work and they can't come in to do the phototherapy. So therefore we will often use systemic therapies or biologic therapies. Systemic therapy, the ones we traditionally use, such as methotrexate, affect the skin and the immune system in a non-specific way, whereas biologic treatments are very specific. They act on one particular molecule and bring that molecule down to a normal level to improve the immune system.
All right, now I'm going to Dr. Green's office and to get my first dose of Stelara, which I'm excited about. And hopefully this will help clear my, psoriasis. Dr. Green is actually, he has psoriasis himself, and he's actually a board member of the National Psoriasis Foundation. So, he understands what our what our as a psoriasis patient is. So that's that's a good quality in a doctor that I would look for, because he understands what as a patient is.
Today's the first injection. We're going to do it today, and you're going to come back and see us in a month, and maybe we'll give you another one in a month.
Okay.
And then you don't need to see me at that one. And then every 3 months you're going to come see me. So after this injection, we'll do 1 in a month, and then 3 months after that. And you're going to see me. So it's only 4 months from today you'll see me again.
Okay.
You'll see Marie in a month for that second injection. It's always that when you start, there's 2 in the first month. Okay? It's not going to work right away. It takes 2 or 3 months. I always want to give a medicine at least 3 or 4 months to work. So I won't change it in that first 3 or 4 months. When I did on that, it's really about.
Great, I didn't feel a thing. The difference between the Admiral, the injections, and between the ointments is that the ointments you have to, keep putting on constantly on your body, like every day, like maybe twice a day. That takes a lot of time. Sometimes it's so much that I get so tired and lazy to do it sometimes. But with the injection, it's easy to just do once a week, and then you just don't have to worry about it. I think that's great that they created this for all of us, and it has helped me clear my skin. I'm able to enjoy being out.